Very good afternoon. Okay. Very good afternoon to all the viewers. And here is an eminent person, Dr. Muralidhar Hegde garu. In front of us is an eminent researcher from the USA. So, sir has came for the 3 days International Symposium on new discoveries in brain disorders. Let us interact with our Dr. Muralidhar Hegde garu to know about various interesting facts about the brain. Sir, welcome to AM Reddy Memorial College of Pharmacy,
My
sir.
pleasure.
Sir, here are the few interesting questions from the side of the students. We are eagerly waiting to know the answers, sir. How well the AI is going to impact the research on the brain?
Immense. There are some concerns about AI which I don't have. I think it has more benefits than the concerns. Even at the research stage, like we now see how the AI is completely changing the way people work. Like to even make the presentations, make the schemes, and the way we propose stuff, we can use AI and save the time there. And in terms of medicine, I don't even go into the robotics which are run by AI, which can make lesser mistakes than humans. But just look at the diagnosis. So, for example, in radiology, I think many of you might have heard of it. So, in radiology, is one of the early fields to employ AI. And just to give a very layman example, so if a doctor looks at a CT scan or an MRI, and then he will remember like 10 patients he has seen, or maybe 50 patients he has seen, 100 patients he has seen, and based on that knowledge or based on what he studied, he will diagnose it. But AI can look at like a million MRI images, which is available in the internet, and then make a decision based on that. AI can also look at what are the mistakes done in the field, misdiagnosis done in the field, and take that into account, make a decision. So far already in radiology, AI people know that AI can do a better diagnosis, even for cancer diagnostics or many of the wherever you use radiation. AI can do better. And especially in US, the people have stopped recruiting radiology faculty, and the number of students going into radiology has reduced so much. That's the impact. It has benefits because the human mind has to make the final judgment. AI can facilitate that. It's not that AI can take up somebody's job, but it can help humans to make better judgments. It's almost, you can think of driving, right? It is there like in Houston where I live. It like I did not imagine that it will come to Houston this fast. So it like just started 3 months back. We started seeing one or two cars driving by itself, and now I drive to office. I see 3, 4 cars, and there's nobody. Nobody means like not no passenger, because probably it's going to pick up somebody. An empty car stopping in the signal and going there. It's like changing every day. And one issue with AI is it's so new, people will always be, every small mistake becomes a news. If AI maybe, instead of turning, it stops, it becomes a big news. But humans make the 10 times more mistake all the time. But number of accidents is always much less with AI. And I can give you one example that, cars have airbags, right? Whenever there is an impact, airbag comes. With AI, now, I learned this recently. So whenever the front car or an object is coming closer with a certain speed, so AI understands that there could be an impact. There's no way you can avoid it, and airbag deploys like 10, maybe 1 second or 2 seconds before the impact happens. So it can actually save lives.
Yes.
And without AI, it will happen after the impact.
Yes.
So this is nothing to do with medicine, but it's exactly like this. Error will be reduced. I think in medicine it has an immense value. And more recently, I have heard that there are some surgeries which were done, eye surgery, which were done with AI, which were highly efficient and highly effective.
One more small question, sir. How was the arrangements done by our prestigious institution, AM Reddy Memorial College of Pharmacy, in organizing? And your few comments about the hospitality and all the arrangements done by the management.
It can't be better. It's the best I have seen. I can tell you. I mentioned like ever since I came to the airport, our kids are surprised because they don't see anything like this in the US. You are on your own. You go and give a talk and come back. So this is extremely important. Even in India, generally you have good hospitality, but even in that comparison, this is like it can't be better than this. So, and the organization is one thing, and the passion with which the morning function was done. It looked like a celebration. I think Dr. Rao mentioned it. It looked like a celebration, and Madam is so proud of everything, and she's completely involved. And I think that you can see that the whole thing happens because of that involvement, and it's wonderful.
Thank you, sir. Thanks for being here in our institution for this gracious International Symposium, sir. Thank you
so
very
much.
much, sir.
I look forward to the rest of the meeting.
Thank you,
Thank
sir.
you so much.
Thank you, sir.